All right, folks. So tonight we are having our town hall meeting. And so when we have these town hall meetings, we touch on all of the program areas that we work within in the greater Houston region. And so across the board, no matter what community we're working within, our mission as an organization is to protect public health and the environment from the harmful effects of toxic waste. Tonight, we are going to cover THEA's Health Survey Initiative. I have a special announcement and topic to cover with you all tonight. And then our three project areas, the San Jacinto River Waste Pit Superfund Site, the Jones Road Groundwater Plume Superfund Site, and the 5th Ward Cancer Cluster. So first on tonight's agenda is THEA's new health initiative. You have all probably heard me ask before for you to fill out one of our health surveys. So now we're going to take a further step and we're going to be launching a new initiative, which we will be asking hundreds and hundreds of people to please fill out our health survey. Why does this matter? So we need your help to learn about the health right now, today, and your previous knowledge of the health of your health community. No, your community's health, sorry. So it's important for us to be able to understand what types of cancer and disease are going on in each community, because Texas Department of State Health Services can only look at the cancer registry with a very limited window. So we need you to help us help you so we can get a better understanding of the potential impacts that contamination in your community might be having on yours or your neighbor's health. Okay, so to further elaborate on why this is so important, the Texas Cancer Registry is very limited in how it can be accessed by our state health department. So unless we ask the state health department to retrieve cancer rates for a specific type of cancer, they won't know exactly what to look for. The database works a little counterintuitive. It doesn't work to where you can go into the Texas Cancer Registry and pull all types of cancer diagnoses for a specific community or geographic area. You have to go in per cancer type, per geographic area, and through a specific time period. So what your surveys help us figure out is what types of cancer the state should actually be looking at for each of these communities. So let's talk about what we know, just very briefly. So for the San Jacinto communities, we worked with Texas Department of State Health Services several years ago to look into the most common types of cancer that we saw in the community at that time. At that time, there were 17 types of cancers that we commonly saw in the community. And so the Texas Cancer Registry at that time only had available data for from 1995 to 2012. So what you see here in kind of this pink color are the types of cancer that the state looked at that came back with abnormally high rates in the community. So they found brain cancer, female breast, male breast, cervical, kidney, leukemia, liver, lymphoma, and myeloma, and abnormal rates in certain areas in adults. Now for children, they found abnormally high rates of brain cancer, leukemia, glioma, melanoma, and retinoblastoma. Retinoblastoma was truly the most startling of them all. The retinoblastoma came back over 16 times what you would expect to see in another community across Texas. That is startling. And this is just what they've looked at. So moving on to what we know briefly about the greater 5th Ward area. Texas Department of State Health Services has looked at specific cancer rates from the window 2000 to 2016. And they have looked at the rates for acute myeloid leukemia, esophageal cancer, bile duct cancer, larynx, liver, lung, and bronchus, nose and nasal cavity cancers, other biliary cancers, and urinary bladder cancer. Now, they also took a further look for childhood cancer, and they only looked at 2 types of leukemia. So they haven't even looked at, say brain cancer, skin cancer, some of these other types of cancer, respiratory cancers for children. And we need that to be done. And so what they did find of the 2 types of leukemia they looked at was acute lymphoblastic leukemia and an abnormally high rate. Now, the most limited data set we have is for the Cypress community. That's the community where the Jones Road groundwater plume is located. So the Texas Department of State Health Services has only looked into childhood leukemia in Cypress from 2010 to 2016, and it was abnormally high. But they did not break that out by type. They didn't look at the types of leukemia. They didn't look at other types of childhood cancer, and really only a limited window from 2010 to 2016. I believe this is just the tip of the iceberg. I think what we are seeing here is not the whole picture. I think, as you can see here in this illustration, there's so much more underwater. I believe there's so much more out there in these communities that we're simply not tapping into because we're unaware. The state is unaware that they need to be pulling additional specific types of cancer rates. So we need you to lend us a few minutes of your time and take our confidential survey between now and mid-May. So what's going to happen next is in May, we will be asking Texas Department of State Health Services to initiate a cancer database investigation for each of these 3 communities. And we will be using the information that you give us only for the cancer type to tell the state, hey, we are seeing X, Y, and Z types of cancer. We need you to pull the rates. We will not share your personal details like your address, your name, none of that type of information. We'll simply be sharing the types of cancers that are reported to us on these surveys. So please help us help you and get a better understanding of the health of your community. So now I have a big announcement and a little bit of what I've gone through lately in my journey. So my husband and I are expecting a baby boy this June. And as many of you know, I have been very open and honest with my health journey. Part of why I have been so open and honest from the very beginning about my health journey is what I was learning when I was in school studying environmental science and geology. I was learning that if it was the environment that was making my family sick, we weren't going to be the only ones. But it's just not common to talk about your most personal health issues with your neighbors or sometimes even your closest relatives. And at the end of the day, if there is a commonality in our communities that's making us sick, then it's important for us to be talking about these things. So I have had a turbulent last month in my pregnancy, and I won't get graphic, but I want to talk with you all about what I have gone through, because as I have gone through this last month of saving my pregnancy, it made me realize that, one, I'm not alone, and that so many women, particularly in the community I come from, go through what I've gone through. And I happen to be incredibly fortunate that I learned what was happening with my body from an ultrasound. So what happened was when I was 20 weeks pregnant, my body started going into silent labor. And I had no warning, and I was starting to miscarry. Fortunately, I have a really great team of doctors, and one of them had suggested that I have my length of my cervix measured in an ultrasound because in 2013, I had the early stages of cervical cancer and had to have part of my organ removed. And despite having this great team of doctors, only one of them recommended I do this. And thank God that she did. And thank God that we did the test, because we found that my body was going into labor and giving me no warning. And this happens to about 1 in 100 women in America. And most women find out that they have this issue with their organ by miscarrying. And we started intervention with hormones and medication, and that was unsuccessful. So by week 21, which was the weekend before the freeze, which I know we all remember that week like yesterday, I wound up in emergency surgery down in the medical center. And I have been on bed rest for 4 weeks. As you can see, I'm sitting on a couch right now. So I was just relieved from full bed rest to light duty. The baby is doing well. We're recovering well, even better than expected. And I felt it was important to share this with you all, because had that doctor not recommended it, I would have lost this pregnancy. Had I not been adamant that we follow up on her recommendation, that again would have happened. And so now I know how to protect myself in this pregnancy and my future pregnancies. But while I was going through this, in the thick of it, I was thinking about the community I come from around the San Jacinto. And it dawned on me that when we worked with Texas Department of State Health Services, they found abnormally high rates of cervical cancer in many of the communities around there. Now, I'm going to go to a slide where you're going to see, this is where I came from right here, Highlands, Census Tract 2529. And I want to direct your attention over here to this table. These are the types of cancer that, when we worked with Department of State Health Services, came back in abnormally high rates for this study area. And you can see here for cervical cancer, 1, 2, 3, 4, 5 different census tracts came back with abnormally high rates of cervical cancer. So many of those women, potentially had the procedure I had to have part of that organ removed. And if they were young women like I was, women still either in or coming up on their the years where they would have children, it's so important to be sure that we're taking these preventative steps to make sure that our bodies are going to be strong enough after that procedure to carry a baby. And you see some of these communities, particularly up here near Crosby and Barrett Station, Census Tract 2518, just north of Highway 90, they're almost 5 times what they should be for this type of cancer. Then I started remembering work that we had done with researchers back in around 2015 or 16, where they were finding that, in the United States is actually one of the developed nations that has the highest rates of maternal mortality in the world. And some of the highest rates in the United States for maternal mortality, which can be, death to the mother or the baby, is right here in Harris County. And we worked with researchers because the community I came from and that we work with around the San Jacinto River Waste Pits is among the highest. And that's right here, zip code 77562. So the zip codes you see here on this screen, greater than 30% of total deliveries in these zip codes have at least one chronic condition. So we're looking at Trinity Gardens. We're looking at the Highlands area over by NRG Stadium, South Union, Sunnyside, Webster. Some of these communities we also work within. And so the first step here is education, right? Is folks being aware of women and their partners and their family, being aware that these issues are very real and they're prevalent in our communities. And so, one, I wanted to share the good news with y'all, that despite my treacherous journey with endometriosis, it looks like I am going to be able to become a mom, and that, you know, unfortunately, this terrible experience that, you know, my family and I have had to go through recently, I hope that it will be able to help another woman out there, another woman in one of these communities that might wind up going through the same thing that I went through. Because like I said, I'm not alone, and about 1 in 100 women do go through this. So now I will quit being vulnerable, and I will get into our community specific updates for tonight. Okay. So first up, we have the San Jacinto River Waste Pits, super fun site, and where we are with getting this nasty waste that you see here in this image. This is a real image from 2010 of waste pulled from the river, where we are with getting this stuff out of there. So the latest site inspection took place the first week of January. I have asked a couple of times for this report from the EPA, but they are actually, last I checked, still, or last I was told, they were still waiting on the report from the responsible parties contractors. And so as soon as we have that report, as soon as it is made, you know, publicly available, I will have my team and I get our hands on it and go through that report. I know there have been some concerns about, you know, changes in vegetation and some changes out there. And so I want to make sure that when we have our next San Jac specific community meeting later this month, that we address any of these new items that hopefully we will have by then. The other pertinent item we are waiting on is the Southern Impoundment final design report. So the final design report has been handed off from the responsible parties contractors to the EPA. And then it went under review from the agency as well as an external agency. I'm not exactly sure which ones, like Harris County Pollution Control, Army Corps of Engineers, Texas Commission on Environmental Quality. I'm not sure exactly which ones of those reviewed this report and submitted comments. But I know that there was one of the outside agencies that took this report under review, submitted comments. And so now we are waiting on that final document that includes the comments to be made available to the public. I am anticipating that as well anytime now. So the last I'd heard was a little over a week ago, and you know, the agency was saying any day now. So we're still waiting, and I'm hoping that by the end of this month, I will be able to update y'all more specifically on these two items. So now we get to talk about the Jones Road Groundwater Plume Superfund site. This is the site that we work with that was actually impacted by the freeze. So I've had, you know, community members, reporters, and others inquire about, you know, potential impacts to Superfund sites from a freeze. You know, this was a big learning experience for a lot of us, whether it has to do with our home, the supplies we keep, particularly in the winter. We're not really used to that. And it's really opened our eyes to the conversations we need to be having with our agencies and our elected officials about storm preparedness, and not just for hurricanes. So looking at this Superfund site now with a different lens, and looking at, you know, actually what are more steps that need to be taken to protect this site from future freezes. You know, with the waste pits, we have a long history of these conversations when it comes to protecting the waste pits from floods. And here we have underground contamination. But there's the soil vapor extraction system that is operating, that is pulling those vapors from underground and into the equipment you see here. Now, when this equipment pulls the vapors out of the ground, it also pulls groundwater. So then what is pulled in that system then gets separated, and you have the water going in one direction to get treated, and you have the vapors going in another to get treated. So what you see here on the left of your screen, anything you see outlined in turquoise with the EPA logo was sourced from the EPA. What you see here on the left is, it's really kind of like a storage container, but it's a metal building that houses some of this filtration equipment. It is insulated, but my home, for example, is better insulated than this metal building is. And I know that when we lost power, I think we lost power for 5 days. My house was 40 degrees inside. And that was during the day when I had checked. So it probably even got colder at night, and our pipes froze. So, I would feel it's safe to say that building was colder, than my home based on comparing the insulation we have. The picture on the right is an inside view at the filtration equipment that's inside that unit. But if you notice here in the picture to the left, just here, to the left of this building, there are different tanks, and this is all equipment related to the filtration and processing of what the SVE system is pulling out of the ground. You'll notice here, there is this white tank. This white tank holds water, and it has no insulation. It has no protection under it if it were to crack and leak. And that's a concern. That's something we need to be addressing with the EPA. And so these other items here are insulated, and a lot of the piping and tubing that comes to each of these individual units on the outside of the building, it is insulated. But really, you have your weak points, kind of like some of our homes, right? Where you have those valves and pipes in the different units in their connective parts. That's where, even a tank like this that's got insulation on the outside, you might have some weak points. So we will need to be having a conversation moving forward about, what exactly this looks like moving forward, what can be done and what needs to be done to protect this system from being impacted from future freezes, because it is currently down. It is not operating. So what does that mean for remediation, right? That means that since mid-February, this unit has been inoperable because of how the freeze affected it. So let's talk about that a little bit more. So here's the unit that we were just looking at. This is an overhead view. And then right here for reference, just beyond this is Bearley Lane. And this would be Jones Road, right? This will be the shopping center and then Jones Road to give the folks from Cypress a point of reference. So February 19th, the SVE system was inspected, and that is when they found that, in fact, equipment and piping was damaged from the freeze. Now, the EPA tells me that this damage resulted in discharge of treated water. So where would that be? So what we're looking at here is an overview of one of the engineering designs, and you see here was the unit again for reference to those tanks we were looking at. And out from here on the eastern side of this footprint is a water treatment, is a water discharge line. So when I think about this, and I'm trying to think of kind of relating what we all went through, I think of our sprinkler systems. If you have a sprinkler system, it's probably not buried incredibly deep. And so that's what I think of when I think of this line. So you've got a water line running out here with treated water being carried through it. And then they're at two different points, it forks off, and you can't see that on this map. Unfortunately. But it forks off here and then a little ways more to the east. And when it forks off, it is then put back into the ground. The treated water is sent into the ground via an injection well. And so somewhere in this part of the system where they have treated water, there was damage that resulted in the treated water being, ruptured or let free to flow in the surrounding ground from the freeze breaking the pipes. And so I don't have a timeline on the repairs. And so the best that I can tell you, though, is that since at least February 19th, it's been down. And we will meet and talk about this specific Superfund site in April. And I really hope to have information for you that this unit is back up and operating so that we don't see too much of a delay from this in the cleanup timeline. All right, so tonight for our updates in Fifth Ward. Typically when we are on here talking about Greater Fifth Ward, we are talking about the cancer cluster. That is the bulk of where we do our work and our services for these communities. But tonight we're going to briefly talk about some of the latest testing that has gone on that I wanted to make y'all aware of. And then in our next meeting that's community specific for Greater Fifth Ward, we will expand upon the testing and the ins and outs of the chemicals and kind of what that really means and looks like. The city of Houston conducted vapor sampling in November. So it has been known by some of our government agencies since at least 2004 that vapor testing needed to take place to see how the underground plume of contamination was acting. What it was it or is it releasing vapors? And so now we have some vapor testing that was done in the soil of some properties. And we still, though we have results from this round of testing, kind of like always, we find something out and then we find out there's more information we need. So we don't have an idea of the full puzzle, but I'm going to tell you what we know. So what you're looking at is, this is the main plume from the Union Pacific creosote plume. And it has migrated over time to the north, which is right up in this area and is under about just over 100 homes. And so the city of Houston commissioned this testing of passive gas soil samplers that they placed in the ground for 2 weeks to see if, in fact, in those spaces between the soil, the tiny, think of like sand on the beach, right? How there's tiny little pore spaces in between those little tiny grains of sand. And so these samplers were there underground for 2 weeks, monitoring to see if there was any vapor migration underground in the soil. And they did, in fact, find the presence of the compounds. So they looked at a few different classes of chemical compounds and then chemicals specifically. And so in total, there were over 20 total chemical compounds that were looked for. Now, I want everyone to understand, this was not the air around you outside, and this was not the air in the homes at these properties. It was the soil vapors that are underground. All right, so this map here is showing you the survey for the one chemical in particular, and that's toluene. And so the physical boundaries here are Liberty Road to the south, Lucille Street to the north, Solo Street to the west, and East Lockwood Street to the east. And within this area, there were 28 samplers placed on 14 residential properties. there were 10 samplers placed on city right-of-ways. And these samplers, again, were monitored for 2 weeks. So that's great. It wasn't just like a quick sample. It wasn't a 1 day, 1 hour, a brief look. It was a 2-week look, which was, I appreciate that the city did take, a bit longer of a look. And so data was only able to be recovered for 35 out of those 38 samplers. And what they found throughout those 35 different samplers was 20 plus vapors present in the soil. So this map here is showing you for one of those chemicals, toluene, showing you the findings for toluene in a spatial context. So what you're seeing here in these varying levels of blue is where those underground vapors essentially were found. And, what they found were low levels. They did find, lower levels of these vapors, but these are not vapors that you would expect to see in a residential area. So it's definitely a great step in the right direction that this testing was done, but it is concerning that you would find these vapors in a residential area, right? This is not an industrial site. This is not a site where you have industrial workers who have training and experience with how to handle these chemicals, how to respond to exposures, how to understand exposures. So it's it's a step in the right direction. It's something, for us to be aware of, to figure out what are the next steps, what needs to take place next to make sure that the people who live, work, and play in this area are protected and are not going to have long-term effects from these vapors that were found in the ground. So there is a great collaborative effort going on with different folks looking into what needs to be done next, what is the appropriate course of action. And so when we meet for the Greater Fifth Ward Community Zoom in about a month, we're going to expand upon this. We're going to talk about the different types of chemicals. We're going to talk about what these levels mean for public health, what the community wants, what the different branches of government are doing. And we're going to also hear from the community members. People live here. There are churches and businesses here and over 100 homes. And so we're also going to be hearing from the community. All right, so with each of these communities, I've mentioned our next meeting. And so hopefully if you're joining us tonight, you received an email about tonight's meeting. If not, we will certainly be adding you to the email list so that you receive these updates. So for the San Jacinto River, we will be meeting on March 23rd at 6 o'clock. For the Greater Fifth Ward communities, we will be meeting April 6th at 6 o'clock. And for the Jones Road community, April 20th at 6 o'clock will be our next meeting. All right, folks. So I am going to go ahead now and open up the Q&A and go ahead and offer for our guests on here to ask questions. And so I'm going to hit allow talk. If you have a question, I see I do have one that was dropped in the Q&A. Please feel free to drop your questions in the chat or use the Q&A function. Or if you are more comfortable, you can unmute yourself, or if you're on the phone line, I see we've got some folks joining us on the phone line as well. You can unmute yourself to engage. The first question I received was, let's see. I actually received many more than I thought. Okay, so one here is, if you have already done the survey, do you do it again? If you have taken our survey and you have not had any changes to your health history, then you don't need to do it again. Like if we're up to date on our survey with any of your diagnoses, then you're good to go. And thank you so much for giving us your time and your information. If you have had changes though, please do fill out the survey. Okay, one question here is, do you know what is contributing to the higher fetal conditions in Webster? No, I don't know exactly, but we worked with a group of researchers, and there's a report that's actually out on, I'm sorry I didn't link it here, but there's a report out on Houston Endowment's website. If you go to their website and you go to reports, I think we also have it listed in one of our blogs. And we certainly will be sharing it more. Researchers wanted to know, like, what is going on in these zip codes in Harris County that is making the county have among the highest rates of maternal mortality literally in the world. And so we worked with them to bring together small focus groups of moms. And they were looking at, is it information? Is it access to healthcare? Is it the environment? Are there some of these outside factors? And so I'm not sure specifically on what the outcomes were for Webster, but they might have more of that information there. And I do recall, that across the board, one of the factors is simply a lack of access to adequate healthcare and information. And, like I said, I have a fabulous team of doctors. More than one OB makes up that team, and only one of my OBs recommended it. So had she not, and, had I just been seeing one of the OBs on my team, I could have lost the baby. And there's a lot of women just like that who aren't being given that information, who aren't being directed in the right path. So it's just so important to make sure that folks have the right information to protect themselves and the baby. Okay, next question in the chat. Are the babies born in the Houston area having higher rates compared to elsewhere? Yes. So there are specific zip codes within Harris County that have abnormally high rates of maternal mortality or comorbidity. So this can be something that the mother develops when she is pregnant, from gestational diabetes to preeclampsia to the pregnancy resulting in miscarriage. Or it can also have to do with an adverse outcome to the baby, or within 6 weeks post delivery. So when you have your baby and you go home from the hospital, you're still at risk for so many things. And so that's also one of the factors that drives this up, is actually what's happening to mothers in Harris County when in that 6 weeks window when they leave the hospital. Thank you, Courtney. Awesome. Oops, sorry, I see I did not unmute everybody. My apologies. I do also want to note that I did get some questions from Carolyn Stone emailed to me this afternoon. I did not have a chance to prepare answers for all of that, but I will be going into those topics more in depth in our meeting later this month, where we have the whole hour just to talk about San Jac. So I definitely will be addressing those, but Carolyn, feel free if there's one or two of those that you feel is, most pressing, if you would like to ask me here, that would absolutely be okay.
I just want to comment. I was confused. I was thinking this was the San Jack meeting. So
Yes.
I understand, and I'll wait for those answers.
Okay. All right. That sounds great. Thank you, Carolyn. Yes, I see a comment in the chat, that Houston has a huge medical center, uh, why aren't we hearing about this? I agree. Part of why we do what we do, right, is, my neighbors and I once felt very in the dark about what was going on in our community when it came to our health and when it came to the safety in our environment. And I bet many of you that are on here today feel the exact same way. And I know how that feels, and sharing accurate information is incredibly important. And having engaged and informed communities is also so important. All right, I'm not seeing any other questions here in the chat. The Houston Endowment survey or study was dropped in the chat from one of my team members, so thank you very much. If you would like to find that, it is there in the chat. We've also shared it on our social media, and we have also planned items to go out in the near future that involve this information as well. All right, let's see. I apologize. I'm missing some in the Q&A. All right, Mr. Fleming, today Harris County Commissioner's Court agenda had a contract with THEA for educational services related to the San Jacinto River Waste Pits. Awesome, glad to hear that. What can you tell me about that? Did it pass? What services? Well, Mark, I didn't know it was on the agenda today. So this is the first time hearing about it. Thank you for letting me know. I knew that it was something that was in the works. And so essentially, there were funds that were set aside for use specifically around the San Jacinto River Waste Pits. And so we have previously received a grant from the county for educational purposes around the San Jacinto River. And we have recently resubmitted a renewal for that contract. And so that's what went through Commissioner's Court, I guess today, was the renewal of that contract. And so essentially, we are asking the county for support for our educational efforts related to the information around the Superfund process, as well as that public health aspect. And over there, what that public health aspect not only looks like our health surveys and the work that we do with the other government agencies, but the fish consumption advisory, right, is so funding to print materials and to actually get boots on the ground and information out to the public about the very real fish consumption advisory that is going on in that area and that has gone on for decades. Okay, let's see. There is another Q&A item here. For the Jones Road site, has there been any engagement or requests to our congressman on the issue of the failed equipment? Is that the right level of federal advocacy? Great point. I actually saw the other day one of the representatives from the area around the Jones Road Superfund site outside. I think it was it was over the weekend. It was one of the days on the weekend, and he was out picking up trash, just out by himself. And he's just so engaged. And so I think it would be appropriate. We have not notified our officials, but I am waiting on an update from the EPA on the status of the repairs and if there's an anticipated timeline for when this SVE system is going to be back operational. And so I think once we get that update, it would be most appropriate for us to brief our elected officials. And I absolutely encourage any of you to call your elected officials and let them know that you're concerned about this issue. We oftentimes find that, you know, they're not being communicated with regularly on these types of issues. So the more they're hearing from y'all, the more they're hearing from us, the better, because we do need the system back up and operating. And Jeanette, I'll send you a picture. All right, let's see. Just want to make sure I'm not missing any of your questions. Great suggestion, Carolyn. Thank you. There's a suggestion made. Maybe some of the grant money could be used to send out mailers to the residents in the San Jacinto River area to inform them of the specific precautions and testing pregnant women should seek, even in the very early stages. Yeah. You know, so I was 20 weeks pregnant. You know, I think a lot of women, you make it out of the first trimester and you think I'm good to go. And we thought that. And then there I was at 5.5 months pregnant and going into labor. And so I fully support education of this topic, but what the grant money can be used for has already been written out in the contract. So I can check though and see in terms of educational material what the budget in there for mailing is, if there would be a budget to get some of this information in the mail to people. So I can definitely check into that and see if it's something that could be incorporated in what was written in there.
Jackie?
Yes, Gil.
You might want to use the Superfund news instead of a mailing. We're going to 12,000 homes.
Oh, that's amazing. That's right.
The commissioner would be glad to have that in the print, I think.
Yeah, that's a good point. So that was Gil saying about, you know, the Superfund news that is distributed to just about 12,000 homes in the area. I know one went out in the first quarter of this year. And it's a great resource for information to be able to get out. So yeah, let's definitely talk about that, Gil, because that's a great idea.
Sure.
And then I have here, Miss Barbara asks if Union Pacific has committed or I'm thinking maybe commented on the findings in the Greater Fifth Ward for the 100+ properties. So there were, so the plume, you know, is known to be under, the groundwater plume is known to be under 100+ properties. The testing actually took place on 14 properties, but you know, we can't say what's on others unless they're tested. You know, we can't know for sure, but nonetheless, I haven't seen or been made aware of any recognition from Union Pacific. If it's out there, I am just not aware of it. I will check on that though before we meet in about a month from now and talk, you know, more specific about this issue. The other thing that I will say is that the types of vapors that were tested for were looked at to see, you know, or they were looked at from a lens of, are these, you know, that these are types of chemicals that are commonly associated with creosote contamination. And so, you know, they were looking at very specific chemical compounds that, you know, are known to be associated with creosote chemicals. And so, you know, in terms of kind of an understanding there between the connection, it's definitely there. So a question here, what is the area of the Fifth Ward site? I will go back. All right, we are good on time. Awesome. Okay, so the Fifth Ward area, let me see, let me get a better map. All right. bear with me. Get you guys a better map of the Fifth Ward area than what I had in that PowerPoint. All right, so this is a much better map here. The table on the right has to do with the types of cancer that Department of State Health Services has looked into for this orange area. And so this is the area we are calling Greater Fifth Ward, made up of many communities, Kashmir Gardens, and so forth. And so what we have here is the area here just north and south of the 610 loop, really, you know, encompassing the heart of Houston, and then to the north east. And so looking within a lot of the intersection of our major highways here, where we've got Interstate 10, 69, or most of us, you know, still probably call it 59, 45, and then also that northeastern portion of the 610 loop. And so this is the 21 census tract area that Department of State Health Services has looked into for what we refer to as the Greater Fifth Ward Cancer Cluster. All right. Awesome. Thank you, Carolyn. Oops. All right, folks. This is, now you are looking at, I'm just trying to get back to the chat and I'm clicking through. So what you are looking at now is an outline of Harris County and all the Superfund sites within Harris County. So, you know, this outlier up here in the north west portion of the county, that's the Jones Road Superfund site. Right down in here, closer to the heart of the city, is where we're looking at, you know, the Fifth Ward area. They have a couple of Superfund sites, the Cavalcade Superfund sites in their community. And then going out to the east, where I came from, several Superfund sites right out here along and in the San Jacinto River. All right. Thank you all for joining us tonight. I appreciate your time. I appreciate your participation. This has been a great meeting. And I would love to share with you the follow-up from this. I know we've gotten some questions in here about the maps, you know, if these will be made public, and also some of the health stuff from the maternal mortality rates. So I would love to share that information with y'all in a follow-up blog. And then I will see you all later this month or in April at our follow-up community specific meetings. And I hope you all have a great night. Thanks. Bye-bye.